I have a completely different sense of it. This program saved my life. If it weren't for it, not only would I not be a doctor and not helping people now, but I know I wouldn't have made it.
You were an anesthesiologist?
Anesthesiologist, yeah. Give us your background a little bit.
By the time I showed up for needing help, it was my chairman said, you should probably get some help in the department where I was in Sacramento.
What were you abusing?
I started out drinking. I was talking with Tina before the show. I started out relaxing after work. Started out with trying to deal with the stress and anxiety of what I thought was my life at the time.
Did you ever perform your anesthesiology treatments or procedures while you were drunk?
No.
Or high?
Really?
Yeah, but however, I'm sure I wasn't all there the next day.
Hungover?
You know, hungover or nervous or really rushing to get through the day, you know, to get to when's 5 o'clock coming. If it weren't for this program, the shame, the stigma, the embarrassment would have been too much.
Do you feel like you're the exception, though, to the rule from most of these doctors?
No, not by any means. What's ironic about this is that the physicians' health programs in the country are really the state of the art for treatment. They far and away exceed the results of any other treatment program. It's really the best.
And Janine, a lot of people say, a lot of people who advocate this secret rehab for doctors say, if it's not confidential, they're going to go underground, and none of us will ever know about their problems.
You know, when are we going to start worrying about the patients, the victims, and stop worrying about the wrongdoer? You know, as far as I'm concerned, there has got to be zero tolerance for any doctor who is addicted to drugs or alcohol and is practicing medicine. With all due respect, you are the exception, doctor, and I truly believe that you would have done this on your own had someone not pushed you to it. But the problem is that what we've got are 8,000 doctors that we know of in this country in this program. Multiply that by what, 20 patients a day, by 5 days a week, by 365 days. We've got people with scalpels, with anesthesiology, running around drunk, addicted, and then we end up with patients who have those results. It is wrong, and it's about time they stop covering up for doctors and that they be exposed for being in a program, not lose your license, but be suspended until you're better. Period.
Yeah, you know what? I just don't understand, and Dr. Giles, maybe you can answer this. I don't understand why it's the doctors, why that profession gets this big break. None of the rest of us would.
Well, that's actually not true. There are programs for attorneys as well. There are programs.
Yeah, I know. Well, but you know, here's the problem.
Because you don't want your attorney, you don't want your attorney to get intoxicated.
There are programs for cops, but they don't run around with guns. Attorneys don't run around with scalpels and anesthesiologists. The risk to the public is too great.
How can we protect ourselves, though?
Well,
how do we know if our doctor's drunk or on some kind of a drug?
Or hungover.
Right. The way you do it is by creating a program that lets an early intervention. You know, the fact is that there are doctors right now who have a problem and don't know it.
But that's not.
They're the last to know.
But that's not the medical board's job. The medical board's job is patient protection. That's their paramount priority, not rehabilitating doctors.
There are so many issues to talk about with this one subject. We want to get you guys to go into the green room if possible and talk to our producers back there, and we can bring this onto the internet and get it a little bit more fleshed out because it is very interesting and there are some important points that we need to make.
You know what? We're going to come back in 90 seconds. There's so much more.